Your mouth is trying to tell you something, but are you listening? There are 5 secrets or signs that your gums may be trying to send to your brain. And if you're missing these cues, you could be at risk for gum disease and even tooth loss. In this video, I'm going to show you the 5 hidden signs that your gums are silently screaming for attention. So pay close attention because I promise this will help you. Here are the top 5 early signs that your gums are giving you. And again, if you're seeing any of these signs, don't worry, because the vast majority of the time it's completely reversible. Key point number 1. Bleeding gums. Okay, now I know this sounds obvious, but there's a lot of misinformation out there. Many people think, oh, I brushed too hard, or my floss must have been rough, but healthy gums do not bleed with gentle, proper cleaning. Period. Here's what you need to know. First, bleeding is a sign of inflammation. It's your body's immune system responding to harmful bacteria, and this is your first and most important clue. But why does it bleed? Well, picture a tiny cut on your finger. What happens? It gets red and swollen. That's inflammation. Your body sends blood to the area to try to heal the cut. And in your gums, the same thing occurs when it's inflamed. Tiny blood vessels become leaky, and that's what causes the bleeding. So if you're brushing and flossing gently and your gums still bleed, that is a major red flag. It's a sign of gum inflammation, and if left untreated, it can turn into gum disease. 2. Redness and swelling. Healthy gums are firm, resilient, and they should be a nice pale pink color. So if your gums are persistently red, puffy, or swollen, that's another sign that your body is reacting to harmful bacteria. Think of it like any other part of your skin. If it gets infected or irritated, it gets red and swollen. Your gums are no different. Plus, it means that the inflammation is active. Things are happening and it's time to take action. 3. Bad breath that won't quit. Persistent bad breath or a constant bad taste in your mouth is a sign of trouble. That bad breath won't go away with regular brushing, flossing, or mouthwash. Here's what's going on. Those same bacteria that cause inflammation release volatile sulfur compounds, which basically smell like rotten eggs. It's a sign of an active bacterial infection. If you're suffering from chronic halitosis, bad breath, you need to talk to your dentist. There's a good chance it's caused by gum disease. Number 4. Tenderness or discomfort. Gum disease in its earliest stages isn't always painful. It's often more about a dull awareness or tenderness than sharp pain. But here's the thing, if it hurts or feels odd when you eat, that's definitely a sign you shouldn't ignore. Sensitive teeth could be a related issue, but it's important to note that gum disease tends to progress slowly, at least in the early stages. So even if you don't feel much pain, it doesn't mean you're in the clear. A lot of people make the mistake of waiting for a sharp pain before they seek treatment, but by then, it's often too late. You've waited too long. The damage is done. And finally, number 5, gums that pull away. If your gums pull away from your teeth, that creates another problem. It exposes the root surfaces, which are not protected by enamel like the tops of your teeth, and that makes them super sensitive. Now, this is called recession, and while it doesn't directly cause tooth loss, it's a sign of trouble. Once gum tissue pulls away from a tooth, it often doesn't go back. So if you notice that your teeth look longer, or if you feel a little notch near the gum line, you could be experiencing gum recession. And remember, it's not always about pain. It could be about sensitivity or other feelings. Now, let me ask you a question. Have you ever experienced any of these symptoms or signs? And if you have, I want you to know that you're not alone. Millions of people deal with gum disease every year, but here's the crucial thing. If you're seeing any of these signs, you're likely in the gingivitis stage, and it is 100% reversible with good care. In fact, it's one of the most preventable and treatable conditions in dentistry. But here's the thing, once it progresses to the next stage, which is called periodontitis, that's when it starts to get serious. That's S, when the inflammation reaches the connective tissues that hold your teeth in place, and it can destroy those tissues, leading to loose teeth and even tooth loss. So now, let's answer the question, what do I do if I have these symptoms? Well, here are 3 steps. 1. Don't stop cleaning. If your gums bleed, it's not a sign to stop brushing and flossing. It's a sign you need to clean that area more thoroughly and consistently. Here's why. Plaque and tartar are the main culprits behind gum disease. They're essentially layers of bacteria. The soft layer is called plaque. When it stays on your teeth long enough, it hardens into tartar. And that's where things get tricky, because plaque is easy to remove with good brushing and flossing, but tartar not so much. Only a dental professional has the tools to scrape it off. Now, the solution is simple. Just schedule a checkup and get your teeth professionally cleaned. Then it's up to you to keep things under control with better brushing and flossing. 2. Review your technique. Are you brushing for 2 minutes, twice a day? Are you flossing correctly? Do you get below the gum line? These are important questions. Brushing too hard or using an old, worn toothbrush can aggravate your gums and make things worse. And if you're not flossing daily, that could be the reason why plaque is building up below the gum line and causing inflammation. Number 3. Schedule a checkup. This is the most important step. A professional cleaning is the only way to remove that hardened tartar calculus that you can't brush away. We can get you back on track. So I want to leave you with one final question. Which of these signs surprised you the most? Let me know in the comments below. And if you've noticed any of these signs, don't wait another day. Remember, knowledge is power. The more you know about your oral health, the better equipped you'll be to take charge of your smile. Until next time, stay healthy, stay informed, and most importantly, stay smiling.